Inoculation begins for the nation's biggest age group. It's a last step for authorities before achieving its targeted vaccination rate. To show what it's like on day one of the mass rollout, our Oh Soo-young lined up for the full experience.
After 6 months of waiting, COVID-19 vaccinations for young and middle-aged adults in South Korea have begun. Vaccinations for the under-50s age group started Thursday, and I was lucky enough to be able to book a slot on the very first day. 네. After checking into the clinic, all I have to do is fill out a simple consent form and also some information about my health status before I get ready for the jab. Around 15 million South Koreans aged between 18 and 49 now qualify for the jab, and some 11 million who booked an appointment through the early reservation system will receive their first shot over the next 5 weeks. 네. Well, here's 0.3 milligrams of Pfizer, and I'm ready to take a shot for Arirang News. Dr. Chung Yoo-min delivers the shot and also some words of advice.
Take at least 3 days to observe how you are physically, and if you feel any abnormal symptoms, please seek medical attention. You should avoid excessive exercise and alcohol consumption for a week.
네. 네.
오늘 샤워하지 마시고요.
네.
주사 맞으시는데 붓거나 빨개지시면 냉찜질 하세요.
네,
그리고
알겠습니다.
아프시면 타이레놀 드시고요. 오늘 맞으신 화이자 안내문이거든요. 집에 가셔서 자세히 읽어보세요.
네, 감사합니다. Well, after waiting 15 minutes to make sure that I don't have any immediate side effects, I'm ready to go home, but still wearing my mask and still following social distancing rules. So I'm just going to take this off now. Among infected patients aged 18 to 49, health authorities said Thursday that 92.7% were unvaccinated. But with inoculations gaining pace, the government expects to have 800,000 to 1 million people get the jab each day, with 70% of the 51 million people in the country having received their first vaccine shot before mid-September. It aims for full vaccination for over 70% of the population by the end of October. From then, the focus of K-quarantine is expected to shift from distancing to living with corona.
Then we can make a coronavirus weak enough, which cannot invade our life too much. For doing that, we can do some sort of restriction for the high infectivity people by isolation and quarantine.
Most experts say COVID-19 won't completely go away. But as our immunity grows and we learn to live with it, the coronavirus will no longer be novel but normal in our lives. Oh Soo-young, Arirang News.